You start looking at the testimonies of these people that have been through your program that has seen significant impacts on their disease, complete alterations, changes, a different direction, and there's hope. There's hope where there was no hope. You know, for anybody that's gonna look at this video or look at this interview, you've already made the first step in the right direction. Don't hesitate to move forward. Don't hesitate to ask questions, because it's a game changer.
I was first diagnosed with cancer in June of 2020. They diagnosed me with a really rare and aggressive type of cancer that's called collecting duct carcinoma.
My initial prognosis was stage 3C colorectal cancer.
I was finally diagnosed in about August of last year with stage 4 metastatic prostate cancer to the bones.
And when they went in the colonoscopy, they found what looked to be cancer.
They put me on the Finnish gold standard care routine right away. It started with an intense first few days of targeted radiation, followed by chemo on the way to surgery. I think in total in my journey it's been 16 rounds of chemo.
The doctors recommend that I have a type of surgery called HIPEC and CRS, cytoreductive surgery. It was not a pleasant recovery.
We kind of had a difficult time finding a prescriptive path.
They wanted to just basically give me some drugs, some Lupron, ADT, and felt like they were just going to pat me on the back of the head and send me home. So I started digging in and started looking at things on the internet.
My wife did extensive research about trials going on around the country and around the world.
All the cancer was removed. We wanted to keep it that way. I don't quite understand all the ins and outs of everything, so I started Googling and I looked up trials, clinical trials.
That made me reach out to an organization called Heal Navigator. They reached out to me and said, hey, we've heard about this amazing new treatment from an organization called Immunocine, and you should really check it out. We've had some patients try it and the results seem phenomenal. You should absolutely take a look.
I really like the idea that you're taking my blood tumor, you're taking my specific information, and you're taking my blood cells, and you are preparing something that's specific to my problem.
You're looking at my specific malignancy and then training my immune system to recognize that malignancy.
The interaction with the Immunocine team was overall just excellent and easy.
It's a bit nerve-wracking because you get hopeful coming to Immunocine, so when you're on the airplane, it's exciting and you're going, man, I got accepted, I get to go down there. The thing is once you get here, it's like, wow, this is really happening.
It was great that the hard stuff is sort of at the start. They take a sample of the tumor and then they do the apheresis. And then, of course, the administration of the treatment itself was super easy. It was just finding a nearby lymph node and injecting the serum into that. So in essence, a 5-minute activity.
And mentally, you're envisioning this, this process you're going to go through when you get here, and it's actually, the environment's so relaxing that it really makes it a lot easier.
So we get here, and not only am I met with people that care about me, but I met with multiple people that want to be involved, that want to know the prognosis, or explain every step to me, what's going to take place, what's next, what to expect. And, I mean, I've never even experienced that in the medical field.
One of the nicest parts of the stay is that you can relax in a vacation type setting.
It was helpful for my mind to be at the ocean with the waves, and it really was.
This is where things get really interesting for me, because very early after the first treatment, I could feel something really impacting my body. My immune system was targeting the area, and I could see and sense that something was happening.
I could feel some changes in my body. That was what was interesting. Through the treatment, those 3 different injections, I could tell the change. I could tell things were working. Something was changing in me.
After we left Cancun, went home, every 3 months we take tests to make sure he's still negative, which thank God he is. His surgeon was so impressed with his recovery.
He's amazed. He really is.
I mean, just 1 round into that treatment, my tumor markers had gone from over 1,500 to below 50.
Getting home and seeing my numbers change, going home and seeing that my white blood cells went down because things were working, and that things were starting to recover and come back up, and that markers were changing is incredible. I got to have my freedom of life back again.
No pain, exercising tons. I've been very grateful and glad to be able to work. I'm able to travel. I'm here in Cancun. My mindset is that, okay, my body is now perfectly trained and clearly, provably so, to fight my particular diagnosis and the particular tumor I have. That readiness is there, it remains. So I don't go about my days worrying like, oh, it's gonna come back anytime now. So it's a really quite peaceful, joyful place to be. Absolutely fantastic.
And people have doctors that are skeptical, family members that are skeptical, and I say, what do you have to lose? You got cancer. It's not gonna get worse. Sure as heck might get better.
It was the biggest weight off of your shoulders, knowing that, okay, I've got some things to do here. You know, God's not finished with me just yet.